Go, ladies.
Hello.
Hi. Welcome to the Aesthetic Pour.
Cherie says hi.
Hi, Cherie.
Hi, Cherie. Teresa gave us a thumbs up.
Teresa. Hi.
We're going to have to put those down so we don't drink too much. So we can talk straight. Yeah. We can talk straight.
All right, it's 6 o'clock.
Yay.
Okay, we're getting started.
Lives are always so uncomfortable because you're like just staring at the screen, just waiting for people to join.
Ask questions. Keep asking.
Yeah. We have a few that we got ahead of time, so we'll probably start with those and then
There's more come in. We'll
get
get to
move
them.
on to the next ones. So we got our girl in the background. She doesn't like to be on camera.
My favorite place to be, behind.
Behind, yeah. I'm not allowed to do that.
Yeah. Say, can I get that done?
No.
Yeah, it's not fair. I think this is like the perfect day to do this because everybody's
It's
probably
rainy.
inside and it's rainy. And
Grab a glass of wine.
There you
my laser patients that I lasered today, I said, it's perfect that you're just going to go home and stay inside tonight because you get to join us on our
go.
live
Are you
stream.
too live?
Yeah. You're excited. You gonna read one?
Yeah. Sorry, I didn't know we were waiting for more. All right, let's
We don't know what we're doing.
Yeah.
You told us this is what we have to do.
Yeah. This was
You want to
Kristen's
say
idea.
welcome and introduce yourself?
Oh,
So, you go first.
I'm Anna. We're at Mid-State Aesthetics.
Like that's it.
Just in case y'all didn't know. I'm the laser specialist here, and I've been here almost 13 years. This June, I think, is my anniversary.
June my anniversary here. My name is Katie Heel. I'm a nurse practitioner here at Mid-State Aesthetics. June will be my 12th year here, so we're close.
Yeah, right
Yeah.
after the other. It's awesome.
All right. First question, ladies. Can treatments make you look better, but without changing how you look?
Yes. I say this often. There are certain things you can do to make you look better, and there are certain things that make you look different, and there is a difference in those words, choosing those words. So you never want a friend to say, oh, Anna, you look so different. Like that doesn't mean that you look better.
That's like telling somebody they're like really tired.
Yes, exactly. It's like could kind of be a dig. So
Yeah.
I was saying like, oh, Anna, like you look so good. Like, is it your like hair? Is your outfit? Like they can't put their finger on why you look better.
They just know something
yes,
looks better.
something is like letting you shine brighter.
Yes.
So yes, it can be done
If it's done right.
if it's done right.
All right. Next one is, why do some people still have lines even after Botox?
I'll take this one. I say this often too. Technically, Botox does not treat wrinkles. Botox relaxes the muscles that cause wrinkles. So first what has to happen is Botox has to be injected. Then you have to let about 2 weeks go by because Botox is a medication. So it does take about 2 weeks to fully work. Then once that muscle is relaxed, then the skin that is above the muscle that has the wrinkle in it can essentially heal. So Botox is a largely preventative medication. So once your lines are already there, it's not going to be necessarily like Botox done 2 weeks later, everything is smooth. If someone does have lines arrest, we would typically tell them to plan to continue Botox every 12 weeks for your first year. And at that time, then we can kind of retrain the muscles so that way that skin stays nice and smooth in between treatments. Movement is not the enemy with Botox. Lines at rest, that's what we're trying to target. So I think we're past like when Botox first came out and everyone had these frozen faces that gave the product usually a bad name. Like I want to be able to emote is what they'll say, but you can still emote with well-placed Botox, which is the kind of Botox we do here. So you'll still look like yourself, just with less lines. So.
I think another good kind of piggyback question on that too is that we always get, when is it a good time to start doing injections?
Yeah.
So I think a really important question is obviously what's right for you.
Mhm.
I think that's a personal question. But for us, we would say if you're trying to prevent something, it's easier to prevent than trying to fix something that's already there. So if you're starting to kind of see a little fine lines or maybe an even wrinkle, it's really a lot easier to start getting injections then to stop a little bit of that movement before that wrinkle really sets in deep. And then we would have to do other treatments to help induce that collagen induction and things like that. So it's easier to kind of prevent than trying to fix that at a later time.
And I'll tie that in too. So if you have had Botox and you notice your lines didn't go away, there are things we can do to make that skin heal a little bit faster. And so that would be good medical grade skincare, laser treatments, microneedling, things that help induce, like Anna said, the collagen remodeling within the skin. That, love analogies. This is my first one.
Write it down.
Okay, no.
Is it the first one?
This is my first one.
I was ready.
I have a goal to do at least 4. So it's going to be easy. It's going to be like the first 15 minutes. But so if you had a shirt that was stuffed in the back of a drawer, and it was all wrinkly, of course, first you have to hang it up. The wrinkles don't immediately fall out. Laser treatment could be something that you do. Think of that as like a steamer. So now we steamed it, and now the skin lays flat. Of course, you still have to keep it hung up. You can't stuff it back in the drawer. That analogy is continuing with your Botox. But then we can, it's a good marriage of the two, Botox and laser treatments, collagen stimulating treatments, microneedling, anything like that, that is like the steamer for that wrinkle at rest. So analogy number 1.
I have an analogy too. You can't go to the gym and have this amazing workout and then go eat at McDonald's and expect to get great results and be skinny and all the things. It's kind of the same idea. You have to do all of the things at the same time, or have a plan for your skin throughout the year. So we'll talk more about that later, I'm quite sure. So
Sure, we'll get to that.
All right, we had a question come in that says, what are the top 3 ingredients I should avoid when choosing products?
I'll let you go first.
Well, petroleum
Oh.
obviously is a no-no. Mineral oil.
But why? Obviously, I don't know.
Okay, so what happens when mineral oil is probably a little bit more known in products, lotions, moisturizers, things like that. So what happens when you're putting mineral oil on your skin, you're completely blocking that pore, no matter where you're putting it on, and then nothing else can kind of penetrate through that. It can cause milia, it can cause irritation, and you're not able to use active ingredients on the skin either. So long-term use over time can just cause more problems than actually help the skin. So it's just not
It's a cheap filler ingredient.
It's a filler ingredient, correct.
It's like, what are you paying for?
You're paying for it, and it feels good. That's why they use it. So it's just a cheap, like Katie said, it's just a cheap thing.
Isn't it killing the rainforest too?
Yeah, it's killing the rainforest, so obviously we can't use it. So yeah.
Mine would probably be parabens. So what is a paraben? Paraben is an ingredient typically put into skincare that is a preservative. So I jokingly say it's great for the companies who are making this product because it allows their product to sit on the shelf for years and years and years and not separate and not decay and not go bad. But just like how we probably shouldn't be buying food that has preservatives in it, it doesn't belong in our skincare either. So another thing that happens with parabens is it seems like parabens can trigger certain inflammatory skin conditions like acne, rosacea, perioral dermatitis.
All things that are extremely hard to control or get rid of or treat.
So the good news is they're easy to find. You just flip over the back of your skincare, and thank goodness they're usually at the bottom. So read your skincare from the bottom up. And a lot of really good, reputable, recommended brands, you'll notice, do have it in it. And so you have to, unfortunately, reading ingredient labels doesn't stop at the grocery store. You also have to check in all your skincare too. So
I think that was another question of why should I buy skincare from a dermatology office versus Sephora? And that is probably one of the biggest reasons is ingredients. You have to read your ingredient list just like you want to read your ingredient list of what you're putting in your body. Same thing as what you're putting on your body, especially on your face and your neck.
We've already done the work for you in selecting the products that we carry here. Yes, so.
Absolutely.
Ready for the next one?
Ready.
All right. We have, what makes your approach as a provider different from other injectors and laser providers?
Oh, we love this.
Yeah. Okay. I would say our biggest approach is that we are a team. We each have our own little niches. Mine is, is that right?
Niches.
Mine would be injectables. So that would be neuromodulators like Botox, Dysport, dermal fillers, collagen stimulators like Sculpture Radius. That's predominantly what makes up my day. But that targets technically all of the things underneath the skin. So Botox, Dysport target muscles that cause lines and wrinkles. Filler targets volume loss and structural changes that happen underneath the skin. I can do this analogy. I can do analogy number two. Analogy number two. This one's a favorite. Okay, so imagine that you're 25 years old and you're absolutely perfect. Your skull is your bed frame. Your soft tissue is your mattress, and your skin is your comforter. So fun fact, as we get older, your skull and the soft tissue underneath your skin shrinks, it gets smaller. So yes, exactly. So imagine you're 25 years old. You got a queen size bed frame, a queen size mattress, and a queen size comforter. That bed lays perfectly, everything fits. However, unfortunately, as we get older, the bed frame and mattress turn into a twin size bed frame and mattress, but you still have the same queen size comforter. So what surgery does is they take that twin size bed frame and mattress, and then they take the comforter and they cut it to make it match the twin size bed frame and mattress. So that's all well and good. And if you're open to surgery, get a consultation, but we are for the patients who want minimally invasive treatments. And so what we do here is what I said, what if I told you we could structurally work on rebuilding the bed frame and mattress into a full size and then get as close to that queen as possible. That way that queen size comforter now lays, your skin now lays on the bed like you remember it laying. And so that kind of transitions to Anna, where I would say the laser treatments would be like a professional dry cleaning or steam cleaning for that comforter, to where you freshen it up, make it look brighter, which is just as important as having the correct size bed frame and mattress that fits that comforter. So,
and even with surgery, they're still going to do laser treatments on you because they can't fix
the skin
wrinkles and skin with pulling it tight. So even when you get those types of things, you're still going to have to do something with your skin and continue to do things with your skin too. So lasers are always a need, guys. Always a need.
Healthy skin is always in.
Yeah.
Awesome. Ready for the next one?
Yes.
Okay. If I walked in and said, I've never done anything else, or I've never done anything before, where would you start?
I always ask a question back to the patient. I'm always asking what bothers you the most. If it is pigment, which is usually probably one of the number one comments we get from patients that they're bothered with, I would say our Duo Glow, which is 2 laser treatments. So we would do probably about 2 treatments of that once a month, and we would really kind of concentrate on, when you look in the mirror, what sticks out to you. So that's really kind of what I would ask the patient. I'm not just going to say, oh, well, this is always what we start with. That's, again, why we're such a good team, is that we're not just going to throw something at you just because that's what's appropriate or that's, where we start. We're really going to kind of ask questions over just what's on our menu. So, and I think for Katie, I think that's the same
Get to what brought you in here.
Right.
And always making sure it's the right tool for the job. We offer different modalities here because each one does something slightly different and excels in something that's slightly different. So nothing is necessarily a replacement or an instead of. It's you can start here. Yeah, you can start here and eventually maybe we'll get there. But whatever your comfort level is, we start there with you, and we are on this journey with you together, wherever that starts. So.
And I think the other thing too is that we don't just offer laser treatments for things too. We also have other treatments that, if that's something that patients aren't comfortable with, we have peels, we have other treatments, facial treatments, and microneedling and things like that. So we do have other options for patients if that's not something that you want to just jump right into. We live and breathe all the things that we do, but we do have other things that we offer. So we have all options for all patients, any age, for whatever you need. So I think that's important.
But a customized approach for you, your concerns will keep you looking like yourself, just a brighter,
Just better.
yeah. Better but not different. Those are technically
That's
different.
All right, this one came in from social media last week. It says, what happens if I stop using Botox and lasers? Do all my original wrinkles, spots, and aging issues just come back?
So it's like, imagine it's like pressing pause and then rewind, and then it's like pressing play from wherever you rewound it to, whether it be your skin health and quality with laser brightness. People say like, I got laser one time and I was really happy, and then all my pigment came back. And it's like, well, no, the pigment fell off and washed it off, and you saw it fall off in the sink when you're washing your face. That was all your same old pigment from all your past sun damage and all your other bad decisions then now reach the surface. So, no, they don't come back. We continue to get sun damage, get pollution. We continue to age. We continue to have those changes. So again, whatever rewind time and however long you want to continue your aesthetic journey, and then you stop, and then you just go back to how you look before you got those treatments.
Good to go. All right, another one that came in was, is there such a thing as a one and done treatment?
No. Unfortunately. I mean,
wouldn't that be nice?
It would be
Yeah.
so nice. We would, it would just be, heaven. I mean,
even surgery,
yeah.
a plastic surgeon would tell you your eyelid surgery is lasting you 10 years, a facelift is lasting you 10 years. It's not necessarily like, okay, I get to, this might be a good time for analogy number 3.
I'm at 5.
Imagine, oh, you are? Oh,
I'm at
okay.
5.
Well, look at that, we're 17 minutes in and I've already beat it. This would be, imagine like this is going to the dentist. So my dentist analogy is medical grade skincare is like brushing your teeth twice a day. So that is non-negotiable. We do it every single day because we are trying to maintain the health and quality of our teeth. That being said, if you have a toothache, your problem or a concern and brushing probably isn't helping anymore, then you need to make an appointment with your dentist and go to the treatment chair. So then the analogy is that you need to make an appointment here and sit in our treatment chair. So I say I had a cavity and I got my cavity filled, but I don't have to brush my teeth anymore, right? No, like not if you want to keep your teeth. So you still have to go and you still have to continue doing your home skincare again with good quality products. And then I still need to, guess what? Get my teeth cleaned every 4 to 6 months for the rest of my life, as long as you want to keep them. So it's that same thing, is that just like how your teeth are constantly being exposed to food and acid bound in wine and coffee and tea. Same thing, your skin is still being exposed to stressors like the sun, pollution. Lines are still forming caused by the dynamic muscle movement. So you're still.
I think I heard this today, and it kind of reminds me of something I need to remind everybody. Even wearing sunscreen, I hear this every single day. I wear my sunscreen every day. I wear my sunscreen every day. Amazing. I want you to do that. I don't want you to stop. I think that's great. But we have to remember that when we come in and they're like, oh, I have all my pigment came back, or I have new pigment, or new spots came up. Sunscreen is not going to stop that from happening. Sunscreen is going to stop harmful rays from happening, skin cancer, things like that, harmful cells and rays and all of that. But it's still not going to stop pigmentation. It's not going to stop sun damage from the skin. You have to protect it with a wide brim hat, makeup if you can, tinted sunscreen, things like that. You have to really just cover the skin. I wish we kind of had this
Picture.
We'll
share it
ready.
Yes,
we'll share it. So it was a perfect analogy of what they were trying to prove of what sunscreen can do versus not wearing sunscreen for years and years and years. I'm sure this man was probably in his 70s or 80s or something, and they were showing his arm versus his stomach. And they were like, oh, look what sunscreen, he wears sunscreen on his stomach versus his arm. And I said, No, he wore clothes on his stomach. He didn't have clothes on his arm. Therefore, he had all the sun damage on his arm and sunspots and all the things. This was covered. This wasn't sunscreen. This was literally wearing something over top of his skin. What I always say, wear a hat, wear your tinted sunscreen, wear your makeup, wear all the things. That is going to protect your skin more than anything else. It's like wearing a t-shirt on your face. That's what I always say. So that's definitely way more needed than just wearing your sunscreen. So
it's counting as
it's counting as well. Yeah, you can add it to Katie's list. Yeah, for sure.
All right. Okay, one of the other questions we got from the internet was, not the internet, our social media, sorry, was what's the most common mistake you see your patients make?
I don't know that our patients technically,
I think aesthetic patients in
general.
Okay.
I would say social media is probably a detriment to
TikTok.
Skincare in general. I think it's I have a really hard time when we spend all the time of really learning our craft. We live and breathe what we do. We learn our ingredients constantly, every day, every single day. We feed off of each other, training, spend money on what we do, learning everything that we do. And, we spend all this time talking to our patients, going over all these things with our patients. And then they watch a video on social media, and they're like, oh, this sounds great. I want to do this, or, oh, what about this? Or, and not necessarily our patients, just in general. And so I think that's a really hard thing.
Or even when I see on social media, I always think it's funny. They'll have like this technique. I'm like, where's the after photo? It's like, they didn't show you that. Or if they did, it was highly edited and washed out with light. So be skeptical. You have to be a detective when it comes to some of these before and afters and see if they're trying to trick you.
I mean, AI is such an issue with skin, makeup, everything these days too. So I think that's a whole other issue too. Yeah. So
I work here.
Most everything is not real. So our photos are never edited. We don't edit our
The question was, what's the most common mistake you see patients make?
And then, like Anna said, mistaking this like fake filtered edited skin as being real skin. There are some good social media accounts out there that show the celebrities at red carpet events, with what before it was edited and then like what they posted. And it shows that like everyone has texture, everyone has pores, and you figure they had a professional team of people working on them and all the best makeup and skincare and everything that money could buy, and they still have the same concerns we do. So if you're going to hold a magnifying glass up to your face, make sure you're giving a fair shot and not going off of something that doesn't exist and isn't real in the first place.
Well, first of all, throw the magnifying glass in the garbage unless you literally can't see. Like, that's just number one.
Anything that people can't see from a normal social distance. If I can't see it from this bar, you can't worry about it. Because nobody else can see you that closely. 10x mirrors are the devil. Yeah.
That's really how we feel about it.
Okay, here is one. What is the difference between a chemical exfoliant and a manual exfoliant?
Oh, I'll take this.
Okay.
This is one of my favorite things. Okay, so a manual exfoliation is a something that you're going to use with a tool, which is either microdermabrasion or like a scrub, something that you can feel that's going to like an abrasion on the skin. There are ones that you can use every day. This is Katie's favorite. We didn't plan this, but we're just gonna
do this one.
Or we'll do this one. Yeah, this is an exfoliating gel cleanser, and you can actually use it every day. But it's gentle enough because once that bead is used, it breaks down, and you're not going to over exfoliate the skin. And then chemical exfoliation is an actual chemical that it's going to penetrate the skin a little bit more deep, and actually.
And evenly too, whereas this, I mean, the pressure, how hard
it's
you
just
push
very
here
superficial.
Versus,
yeah, very superficial. And there's all different types of chemical exfoliations. So when you hear a chemical peel, Those are a little bit more aggressive. You can come in the office and get chemical peels, and those will actually peel the skin off. And then there's chemical peels that you can do at home that we have pads that you can do twice a week that have glycolic acid, they have salicylic acid, they have lactic acid in them that can just kind of get that top layer of skin off, but you can sleep with that lactic acid and glycolic acid and all the things, and it can penetrate that skin a little bit more to chemically exfoliate the skin. So you're going to feel tingle a little bit and all of that. So your skin's going to wake up and feel like a little baby's bottom. And that's a good example of maintaining what we do in here at home. So your results, what we're doing in here, are going to last a lot longer when you're at home too. So the difference between the two is how you feel and more of what you're getting deeper into the skin.
Well, like an example of an absolute no physical scrub would be St. Ives or those like walnut containing. Oh yeah, apricot.
Because I mean you can actually
jagged.
tear the skin with a lot of physical exfoliations. So just because it's gritty doesn't make it good, doesn't make it better. A lot of patients think that it's like, oh my gosh, I feel it, so it has to be good.
Off,
I'm gonna scrub it and it feels better. If I don't feel like I'm getting a scrub, then I don't feel like I'm clean. It's actually probably opposite of what you think it's doing. It's stripping your skin of all of its natural oils. Your skin's gonna overreact and have reactions and get red and irritated and cause micro injuries, and then over time that's gonna cause texture and redness and capillaries and things like that. So it's just easily avoided for sure. So
ready?
Yeah.
Okay, one just came in. It says, is there anything that I can do that would actually help with my pores?
Yes.
Couple favorites.
I'll take this too.
Okay. I'm sure I'll have
All right. Probably my two favorite treatments would be Moxie. Moxie's going to give you some pore induction as far as, creating that injury, collagen induction, things like that, and giving you a really good glow for an event or something like that. It also helps brighten the skin. But if you're wanting to really, really help the pores, Ultra Clear is going to be your best friend because it's an erbium laser, same type of laser as CO2. I think that's a good thing for us to mention as well.
Cousin to CO2.
Yes. So it's
more beautiful.
Yes, it's
kinder cousin.
It's a classier laser.
Yeah,
it's a classier laser. And there's all different settings on it. We can really customize it to your skin. So just the 3D Miracle, I've had patients say that their estheticians noticed a huge difference in their pore size and things like that. So very little downtime with that, but absolutely. So what happens with pores is that, we're all born with pores. We all have a pore size that we're born with. But as we start to age, and when I say start to age, I mean at 25, our collagen starts to break down at 25. Our pores, our skin starts to kind of not droop, but stretch a little bit. Our pores start to appear larger because our skin starts to change, our bone structure starts to change. So our pores start to appear larger. So what we have to do is we have to injure that skin in a controlled way to wake up that collagen and rebuild that skin back up. So the best way to do that are lasers and microneedling. Those are our favorite two treatments that cause that. And I think Ultra Clear's, top dog right there. So
I do have something to contribute.
Okay,
dental analogy. So that's your treatment chair, but you also still have to be brushing your teeth twice a day at home. So you also have to have good medical grade skincare too, in order to keep those pores as teeny tiny as we can possibly get them. And so my favorite product for pore size is Skin Better Maestro. So Maestro is a really cool product. Most skincare products are targeted towards like one specific concern. So whether it be a cleanser is cleansing, or a moisturizer is attempting to hydrate the skin, or vitamin C is brightening, or retinol is wrinkles. When they came out with this product, they were just looking at how do we maintain homeostasis or balance within the skin. And it was an interesting concept if you consider a lot of things that we don't like about our skin are caused by that dysbiosis, that potential inflammation, that lack of homeostasis. And so me personally, when I started using Maestro, I noticed that people kept asking me about like my makeup, like what makeup I was wearing, and my makeup hadn't changed in years. And actually, it was Marie who pointed out, she's like, well, it's probably, I was like, why do people keep asking about my makeup? It's not any different. But it was because good skin is the best makeup. Yeah, my skincare change. Good skin is the best type of makeup you can buy. And so Maestro has been a favorite, along with a good retinol that's not too irritating to your skin. So a lot of retinols are very irritating. I'm sure you've seen it, where you get red and crusty and peeling. You're feeling like a snake, especially around your mouth. And so some people will say, well, that means it's working. Okay, I have another one analogy. Okay, I'm not gonna get it.
We should have done a max, not a minimum.
I'll get a Bruce Willis analogy. I tried for Will Smith. Okay, so I'm sure we've all seen the movie Armageddon, and so the asteroid headed towards Earth, and they say when they're meeting, well, why don't we just fire a nuke at this rock? And they say that it won't work because it's just going to cause a bunch of surface irritation, and it's not going to take care of the problem. So what did they have to do? They, Will Smith and Ben Affleck had to go up there, and they had to drift.
Will Smith, first of all, Will Smith was not an Armageddon.
Bruce Willis. We were talking about Will Smith earlier. Okay. Bruce Willis and Ben Affleck. I was going to try and do it. They drill down, and then they get what was it, a bomb? Anyways, they get it where it needs to be.
A laser.
A laser.
It was a laser.
It was a nuclear bomb. I'm pretty sure. It was a laser. Okay. We'll check that. ChatGPT that. And then it got down in, and it actually did the job. And so that's the analogy of now there are better retinol molecules that get down into the pore, do what you're hoping to do, which is building that collagen, keeping fine lines and wrinkles at bay, while not causing all this surface irritation. So favorite for that would be Skin Better Alpha Red Overnight. Yeah. So that one has been, yeah.
We have a body one too, which is Chef's Kiss. Yeah.
But Alpha
Actually, I think you're right. I don't think it was laser. I think
it was a bomb.
I'll give it to you. Oh, it's fine.
But it was
Bruce Willis had to stay on the moon.
That's right. He had to stay on the moon and die. All the things.
Oh wait, the asteroid.
Yes. Okay, fine.
Okay, the next one just came in, and it's maybe you have to answer it. It says, will you tell us what you personally do to your own faces?
Like injectable wise?
I guess just maybe your routines or what you've done.
I mean,
that's what it says.
Yeah, I'll tell you everything.
Well, you want a shorter list? What happened?
do you want me to tell you what I put on my face every day? Because you might be here for a long time. I mean, y'all did a video of what you did to my face last time.
Yeah.
Okay, I'll start. Injectable wise, I will get as much Dysport as I can get that day. Usually the bottle is empty, and that's the only reason I stop.
We're Dysport fans.
Yeah.
Just so you know.
Dysport is a different brand of Botox if you've never heard of it or been familiar with it. But I do Dysport my frown lines, my forehead, crow's feet, neck, and then upper lip, DAO. I don't do my chin. No. But I do have chin
They told
filler.
me I have to do my chin.
I have chin and jawline filler. I have lip chin shadow filler. I do PRF under my eyes, and I have temple Sculptra. And then
Did you do that?
yeah. It's just, I said that.
Neck
Botox, yeah. And then I try and get a laser treatment every 3 months. It would alternate between BBL Moxie and Ultra Clear. And then as far as skincare goes, I'm assuming that's the question. Skin Better cleansing gel, Skin Better refining.
It would probably be easier to say what she doesn't use or what we don't use than what we do use.
I was gonna say this would be like the stack, your antioxidant, even tone intensive. I mean, if you live in Florida, everyone should be on this one. Maestro. This would be morning, along with Plated Eye, and then nighttime would be Plated Intense, Skin Better Alpha Rip Overnight, and IMAX. And Latisse. And those would be like the core non-negotiables that are always going to happen. And then sometimes we'll pepper in some other fun ones like an enzyme exfoliant, the Skin Better pads. But those initial ones I showed you are like don't change. Those are sticking around forever.
And she'll get a brow wax like twice
Oh
a
yeah,
year.
I need them now. Oh, I'm putting Latisse on my eyebrows and growing all over the place. Okay, you have to go now.
Okay, I mean, Discord.
Everywhere.
Yeah, everywhere. I haven't done these.
Oh yeah,
I don't think I've done these yet. 11 syringes of filler. I mean, Katie can tell you more so where I put filler at. I'd lost a little weight, so I felt like my face was falling a little bit. So I felt like I needed a little more structure, and I felt like I've never had a chin before. I feel like I probably need more chin still, but so she just kind of gave me some structure, and I didn't look in the mirror until I was done. She's like, "Are you gonna look in the mirror ever?" And I was like, "No." I totally trust you. She's like, "What if you don't like it?" And I was like, "It's fine. Everything's fine."
Yeah.
So
and
yeah,
it was done so well. I was here the day after you got it, and I was like, "You are glowing. What happened?" Like, it wasn't like
that's so true.
What about the girls trip?
That's so true. And then I went on a girls trip to California with my best friend, her sister, who's one of my other best friends, her mom, other good friends, for a week. Not one of them. They kept asking about my makeup, if like something changed or whatever. And I was like, no. Didn't know until I posted the video of me getting injected. So just to show you, that's such a perfect example of, and I did that on purpose because I wanted to see if people would notice, you know, after all of that, if people would really notice. They noticed, but they didn't know.
Everyone will notice, but no one will know. Yeah.
Correct.
Well-placed injectables, you just look like a better, brighter version of yourself versus some weird, different, whatever you think you know of filler, you have no idea. What is that, the real world?
Yeah.
You would know. I don't know.
What world is your age?
Sure. I don't remember.
Oh my god, I watched it.
I was allowed to watch MTV.
That's why I said never mind. You probably couldn't watch it.
Skincare, plated eye, morning. I do Maestro. I do Trio moisturizer. Depending on where I'm going that day, y'all can judge me if you want to. I don't wear SPF every day because I wear a full face of makeup, full coverage face of makeup, obviously. And at night, I
her shirt on her face.
That's right. I wear a t-shirt on my face every day. And then at night, I do. Let's see. I actually changed to the Tulsi and Snow mushroom cleansing milk cleanser. And let me just tell y'all a secret. I've used the same cleanser for 12 years. Never changed my cleanser for 12 years. And when this one came out, I switched. So pretty awesome cleanser. So I do that cleanser at night. That says a lot. And then I use bamboo face cloth from Amazon. If you don't have them, order that right when you get off this live. It's amazing. You get 6 for like $12. It's so good. And then what else do I do at night? Oh, Alpharetta, obviously. I do a hydrating spray wherever that's at. I've been using Stonecrop, but I think I'm going to switch to the Shiitake one.
I switched to the biphase, and I think I do it 10 times a day. It's my favorite thing.
Yeah, I'm definitely switching to that for sure. And oh my gosh, I just ordered. Well, it's back March, but I do with the oil. But the facial recovering oil, I'll do that like twice a week, just to like schlop. I want to look like a glazed donut, and it's amazing. And I do that like twice a week. So yeah, that's what we do. Oh, and lasers. I mean, let's be serious. I mean, all the lasers, all the above. My patients ask me all the time, they're like, have you done this on yourself? I'm like, I don't do any lasers on my patients that I haven't done on myself. So,
including lasers we choose not to purchase, not to carry around, because there are plenty of things that we demo here that we do not bring on here. Nothing that we have here is something that we wouldn't do personally on ourselves, have already done personally on ourselves, and have our family do, can get excited about. So everything is meticulously researched and tested before we ever bring it here, because selfishly, like, I want the best of the best for myself personally, so and for our patients. And so if there's ever anything better, I promise we'll look into it.
Yeah, I mean, we were in between UltraClear and other devices, and we tried those out too, and we were like, no, UltraClear all the way.
All right, Katie, I think this one just came in for you. It says, can you undo bad filler?
Oh, yes. So there is...
she does it all the time.
Yeah, there is a Control-Alt-Delete button for filler. So I think this could kind of tie into one of the questions you asked earlier about, like, something not necessarily our patients do, but just other patients in general, is that say you heard that filler lasts a year. That was a predetermined number that the companies had to put in their package insert for the FDA. There's actually not, it's not lifespan. It's not like magically disappears after 12 months.
You don't work it out.
You don't work it out. Yes. Arguably, I mean, they're finding evidence of filler lasting 5, 10, 15 years. Patients who haven't had filler in over a decade, it's still visible on MRI. I've personally dissolved under eye filler on someone who had it placed 10 years prior, and it dissolved, and nothing else would have dissolved, so it had to be filler. So, so just, I know you see, oh, I'll just get my lip filler for $2.99. If I don't like it, it'll be gone in a year, but that's not the case. Jokingly, we say that bad filler seems to last years and years and years. So the good news is that you can dissolve filler. The bad news is that it can cost more to dissolve filler than it does to place filler in the first place. So off on a tangent, but the medication that we use to dissolve filler is called Hylenex. It doesn't exist for us in aesthetics. It actually exists in a typically like a hospital setting, surgical setting that they use to help with fluid replacement and surgeries, help some of their medications potentiate better in the surgeries. Anesthesiologists would use it, things like that. So that is why it exists. So as you can expect, it's a very expensive medication. It does not exist for us in aesthetics. It's used off-label for us here, but it does work. And so we have it for patients who want to dissolve filler that doesn't agree with them, isn't serving them. So at least there is an erase button for filler, whereas Botox, there is no delete button for Botox. That is something that's a medication that works on something called SNAP25 that exists in the nerve muscle junction that, thank goodness, your body naturally remakes every 12 weeks. That's why Botox lasts 12 weeks. But the bad news is you can do things like try and work out more. That might make you burn off your Botox faster, but unfortunately, there's Botox you don't like. You just gotta wait it.
You gotta wait it out.
You gotta wait it out.
You can. There are some tweaks depending on
Yeah,
what it
there
is.
are some
but
tricks you can do involving injecting compensatory muscles, things like that. So, and not all bad Botox is related to the amount of units placed. You could use the vials come in 100-unit vials. You could use a whole vial and make someone look 100 units and make someone look incredible, and you could make someone look terrible with 10 units. So it's all about placement and anatomy, not just the product itself. So
I think the one really good thing, I think this is one thing to point out about Katie and Colby, is that when a patient comes in that's had bad filler, and sometimes they might not even know that that's kind of what's happening under the eyes or jowls or something like that, that, it can be taken out and then good corrected filler can be put back in, and then, the problem is solved. It's not necessarily that that's their anatomy. It actually can be corrected and look a lot better. So I think education is even more important to us than just, us doing our job. I think that is part of our job, that we educate our patients on how we can fix something and improve something that's not necessarily permanent, that we can fix what's happening.
And it's not like the filler's fault. So it's just the placement, product selection, the technique used, rather than all filler is not bad filler. It's the other things like technique and choice of product for that specific area.
Well, we have one more question, and I just came up with it.
Oh,
because I saw it on something else.
okay.
So you're gonna have to think fast.
Okay.
Is there, or what is the craziest myth you've heard in your arena?
I don't know.
The craziest
Craziest?
myth.
I don't know. It'll come to us later. But
I know. Oh my gosh, we hear this all the time.
So much better.
I mean, right now, all I can think of is what we just went off of, was that like all filler looks fake or all filler looks bad. Like I've heard patients say that, and then when we can educate them on like, well, here's some of our patients who come here and this is what we've accomplished with filler, and they're like, oh, well, that looks great. It's like, well, you only recognize the bad work, the work that sticks out, that like our brains can realize like that is not supposed to look like that. You just assume that that's because of the filler. I mean, it could have been a surgical result. It could have been, again, the placement of the filler, the technique used, versus you can have incredible life-changing results with dermal fillers. It just has to be done in the correct way, the correct location, the correct product.
We have a great before and after too on our social media. Brenda with hers.
Oh yeah.
Like,
You can go see
Such a good one. Yeah.
Brenda's lips, and so you can see how we can dissolve and then bring her to her baseline and then refill.
It made her look so much younger. It just made her look so much more youthful. It's amazing. I think a big myth in my world is that you can't do lasers throughout the summer. You can't do lasers all year long. I think that's a very big myth. We have lasers that are safe to use all year long. So you can come see me anytime. Yeah, so I think that's it.
Oh, it's fun.
And all kind of treatments too.
Well, I can't get lasers because I like the sun too much. It's like, well, that's why you should get lasers.
Right.
Like,
yeah, you're the number one person.
Yeah, you should be getting it because you are in the sun, you can't avoid it. So for sure. I mean, the analogy is
What's the analogy?
I work out. So I work out and I go to the gym, and it's like because I love cookies and ice cream,
right?
And so it's about balance. I still want to be able to enjoy those things.
Right.
I still want to be able to enjoy the sun, but then still not have them end up in places.
There's certain ones that we can do in the wintertime, and then there's certain ones that we can do in the summertime. So we have all kind of options for sure.
Your savior is coming to your rescue right now. Marie.
Oh,
she just messaged me the craziest thing.
Oh, thank you. Yeah.
Oh, good. She'll remember. Yeah.
Is that Botox moved to this patient's legs, and that's why they can't walk.
Oh, yeah.
Oh.
That's what one of the patient's best friend's husband said. They couldn't walk properly anymore.
Oh, okay.
Wow. You're really powerful with your
Botox. Yeah, I think,
My goodness.
I mean, there was, you can't, I feel like I have another weird one. Now it's falling off that.
If anybody's got the good stories, it's Marie.
Yeah.
I mean, I do get a lot, like, with lasers, like, is this going to mess up my thyroid if we do my neck? And I'm like, I mean, if it messes with your thyroid.
The devices we choose are
I have the wrong setting on.
Yeah, we purposely choose them. Yeah. And we purposely don't have devices that
could cause issues
do things like that.
Yeah, exactly.
If there's a technology
I don't want that laser.
Here. Yeah, there's a technology we don't have here. There's a reason for it.
Yeah. Are we good?
Yeah.
Yay.
We blew through all the questions that came in and the ones that came in before and what we had written down. So,
well, thanks for coming to our first aesthetic tour.
Yeah.
Maybe we'll do this again then if y'all like it, and send in some more questions.
If not, we'll just tour by ourselves.
Yeah. And not film it.
Yeah. Love you guys.
Bye.
Bye.